Morning, the Rules Committee will come to order, and welcome back to the Rules Committee. Today, the Rules Committee will continue its consideration of H.R. 1628, the American Health Care Act of 2017. As I had committed to each of our members of this committee at the end of our over 12-hour plus initial hearing on this topic, I have once again invited back expert witnesses who would be available not only to testify with us before today, but also on the manager's amendment that was submitted last evening to the Rules Committee. I want to thank the gentleman from Hood River and the gentleman from Montgomery County, Texas. Is that Spring, Kevin?
Yes, sir.
Spring. The Woodlands.
Yes, sir.
And I want to thank both of you for getting up. Greg Walden is an Eagle Scout. He's used to getting up early. I threw a paper route. It's easy to get up a little bit early.
Reminds me of my old morning radio days.
There, those old radio.
Except I'm better dressed.
So I want to thank both of you for being here. It obviously is necessary to end up for a professional product that's being done. Listen, in all seriousness, we appreciate you taking time to testify on this 4-page amendment and to explain thoroughly what it does, why it's necessary, and more importantly, some of the impacts that you believe will be attached to it. The underlying legislation has been already discussed before the committee, as I said, for some more than 12 hours, but we feel like it's important to finish off the task properly. As you and I both know, it was a topic of conversation on media yesterday and certainly within all of our members. So without objection, anything you have in writing will be into the record. And I would like to defer, if I can, to the gentleman, the ranking member of the committee, the gentleman from Worcester, Massachusetts.
Well, thank you, Mr. Chairman, and good morning, everyone, or maybe just morning. There's not much good about this morning. For those who haven't been following every twist and turn of this drama, let me recap. We're here at the early hours to report out a rule on a health care bill that will push at least 24 million people off their health insurance, a bill that we'll be voting on in a matter of hours. As if that wasn't enough, this rule will rewrite the bill to make it far worse. How much worse? It's hard to say. We only got the text of the latest backroom deal late last night. We've barely had time to read it ourselves, let alone hear from the nonpartisan Congressional Budget Office on what the impacts might be. We were given no information from my Republican friends about what the final product of this disastrous process would look like until late last night. We haven't got a clue how many people might be hurt by the latest version of this bill. Now, I'm not one to mince words, as you all know, but even I don't have the ability to adequately express my outrage here, Mr. Chairman. We do know that this bill will take away health care from at least 24 million hardworking Americans. We know it forces families to pay higher premiums and deductibles, increasing out-of-pocket costs. We know it's a crushing age tax, forcing Americans aged 50 to 64 to pay premiums 5 times higher than what others pay for health coverage, no matter how healthy they are. And we know it steals from Medicare, shortening the life of the Medicare Trust Fund by 3 years and ransacking funds that seniors depend on to get the long-term care they need. We know that this backroom deal will kill the requirement for insurance companies to offer essential health benefits, benefits such as emergency services, maternity care, mental health care, substance addiction treatment, pediatric services, prescription drugs, and many other basic essential health care services. These are called essential health benefits for a reason. Now, again, we don't even know how many people this plan will hurt. We also don't know what the cost will be, and we can't know those things until we get an analysis from the nonpartisan Congressional Budget Office, which, of course, we won't have before we have to vote on this reckless legislation. You know, when will we get that CBO analysis? Who knows? Maybe a week from Tuesday we'll see it. We only just got the CBO estimate for the original 4 managers' amendments last night, and the verdict was grim. Somehow, the Republicans have managed to leave 24 million Americans out in the cold, not one more person covered than in their original bill, while spending $187 billion more than in the last bill, thanks to the tax cuts for the wealthy that are contained in the bill. So every time you come out of a back room, this bill gets worse. Maybe we ought to consider a bill to put locks on the back rooms that you guys huddle in. I shudder to think what the CBO might say about this latest assault on Americans' essential health benefits. Unfortunately, we don't have a chance to find out before casting our votes. So, Mr. Chairman, I am truly, deeply disturbed by what we're doing here this morning. It is irresponsible, and it is going to hurt the Americans we were sent here to represent. And with that, I yield back my time.
I appreciate the gentleman, not only his viewpoint and respect it, but also would like to thank the other committee members who are here and your staff who are taking their time this morning. Gentlemen, today you are once again tasked with a mission. That mission is not only to address the issue that you came to us to, but to understand that probably nowhere else but Washington is our savings called spending. And you would recognize very clearly that this is an effort that you have undertaken for a long period of time. You have expertise, knowledge about the ramifications, and I appreciate you both being here today. Now, with that said, Chairman Walden or Chairman Brady, I'll let you decide how you would like to have your conversation and testimony with us, but I want to thank you, and so I'll let you, as you would wish to prepare your remarks, for you to engage this committee.
Thank you, Mr. Chairman. I think we agreed I will go first and then
The gentleman,
be
Mr.
followed by
Walden
my
from Hood
learned
River,
colleague.
Oregon, is recognized.
Well, thank you, Mr. Chairman, members of the committee. Thank you for giving us this opportunity to come back before you at this hour. I wanted to briefly discuss the amendment that we filed yesterday and how it affects matters within the jurisdiction of the Energy and Commerce Committee. First, the amendment adds maternity coverage and newborn care to the use of funds for the Patient and State Stability Fund. The amendment also clarifies that for purposes of the fund, mental health and substance abuse disorders services, including inpatient and outpatient clinical care for treatment of addiction and mental illness, as well as early identification and intervention for children and young adults with serious mental illness, you can use this fund for those purposes. The amendment also provides an additional $15 billion to the Patient and State Stability Fund. That additional fund, my colleagues, is solely devoted to states for maternity coverage and newborn care, because we heard from our colleagues, both sides of the aisle, that this was incredibly important to do. And it can be used for mental health additional services and to help those with substance abuse disorders. These are all important topics. We heard from many of you on this panel yourselves about how important it was that we take care of these people among us who need this kind of help. So we added $15 billion on top of the $100 billion already included in the underlying bill. And by the way, we have great flexibility on how states can use that money. I had a good meeting with my governor yesterday and explained to her the impact on Oregon that would occur beginning next year, 2018 and 2019, before any of the other major changes in this bill take effect. Oregon received something like $182 million each of those 2 years, which will help with their budget gap in this biennium and be used for very, very important services. The amendment also requires states to determine essential benefits beginning in 2018 for purposes of the premium tax credit. So this change only applies to those who use the premium tax credit for those insurance products. Now, this is not that unusual. I've heard the comments of my colleague from Massachusetts. This does not affect the employer plans. It does not affect Medicare. The large group market already is exempt from these federal mandates, where 155 million of our citizens get their health insurance through their employer. Not what we're doing here affects them. They've already been exempt. And by the way, this Congress, well, not this year, but last year, or last Congress, voted unanimously to remove the essential health benefit mandate of the federal government for the employer market in the 51 to 100 employee range, because they knew the negative impact that would take place. How do we know? Because there are independent analysts out there who have given Congress these data points. Last year, the Congressional Budget Office said the regulations governing insurance benefits would have made non-group premiums 27 to 30% higher in 2016 than they would have been otherwise, according to a 2009 analysis they conducted. We know the benchmark premiums increased 2% from 2014 to 2015, 7.2% from 2015 to 2016, and 25% on our citizens from 2016 to 2017, which cumulatively accounts for a 34.2% premium increase from 2014 to 2017 for the benchmark plans. Is it any wonder that our governor said, please, give us some relief from this one-size-fits-all federal mandate, please? In 2009, CBO sent an extensive letter to then Senator Evan Bayh of Indiana, who requested input on how to draft the Affordable Care Act, how it would affect premiums. This is the origination of their prediction of a 27% to 30% premium increase. So what we're trying to do here is attack one of the issues I know I've heard from my constituents. How come premiums skyrocketed 23% one year, 27% the next year, and they're projected to go up maybe just high single digits? It may be, we've heard 30, 40% in some markets. So we're trying to say, let's give flexibility back to the states. And by the way, in the conversation with my governor yesterday, I said, so if Oregon wanted to maintain these essential benefits, you could do that, right? And the answer was yes. And by the way, we probably do most of these in law today. And I said, if you wanted to keep the ratio 1 to 3 versus 1 to 5 for what it costs for one person versus another, you could do that under state law. And she said, yeah, we could. And I said, and you probably would, wouldn't you? And they said, yeah. See, this is getting back to, it might work in my state. It might not. We'll see, in terms of the market. But they have that right. They have the right to get it right. They have the right to innovate. That's what we're giving them back. We know what the Democrats did, drove up insurance rates. If we don't fix this, people will be left in some counties and some states with no choice on this market. No choice. We know that in 2016, there were 225 counties in America where citizens had one choice on this insurance market we're trying to save. This year, it's 1,022 counties, 1 out of every 3, and next year it will be worse. So, for my friends on the left, do nothing as you would propose to save this market, or join us in the bipartisan effort you've been a part of in the past on this very issue where some of you were even co-sponsors of almost identical legislation involving the essential health benefits, to free it up in the larger small business market. Because you knew then it was a problem, it remains a problem, and it sticks it to people who are least able to cope. We want their premiums to come down. We're trying to bend this cost curve down. We fully believe, Mr. Chairman, this will do that, and I yield back my time.
Mr. Chairman, thank you very much. Chairman Brady, welcome. We're delighted that you're here this morning.
Thank you, Chairman Sessions, members of the Rule Committee. Thank you for allowing me to testify in support of the American Health Care Act. And I would ask that the Rules Committee make an order this second-degree amendment to the manager's amendment to the bill. We know why we're here. Obamacare is a sinking ship, and it's taking a lot of good Americans down with it. We've made the strong case, and America recognizes premiums are skyrocketing. There's so very little choice. People can't see their local doctors and nurses or hospitals. This is collapsing, and is collapsing soon. The American Health Care Act, as we've discussed, unburdens more than $1 trillion of taxes off our families that have more expensive health care plan costs because of these taxes, our small businesses, patients who need over-the-counter medicines and drugs. Washington will take less of what they earn so consumers and the economy can grow. We cut more than $1 trillion of spending that Washington simply cannot afford and cannot sustain. We make important reforms to Medicaid to give states the flexibility to tailor health care to their community and their families. We unburden the mandates that force Americans to buy health care they don't want and can't afford, and force the small businesses to offer health care their workers don't need. We defund Planned Parenthood and shift that money to community clinics so women can truly get the health care they deserve. And we go beyond that. We begin to restore state control of health care. And we begin to restore the free market that is shattered today. The last time we were before you, we brought an amendment that provides tax relief sooner to local businesses and to local families. We created more flexibility and more resources for those in Medicaid and vulnerable populations. And we provided the space so the Senate can do more to help those who are in the 50 to 64-year-old age range. That is an area we all agree we want to do more on going forward. Today, this amendment is about wresting control and power from politicians in Washington and giving it back to the people. This amendment is about lowering health care costs and empowering states to tailor plans to their communities, to their regions, to their families. And yes, it increases funds to those states to address the very families that Chairman Walden just talked about. There is no question, and this should be very clear, this amendment rejects the Washington knows best, one-size-fits-all that frankly has wrecked Obamacare and hurt so many people. It recognizes that states are unique. Georgia is so different than Massachusetts, Texas from California. It recognizes that regions are unique. The Valley in Texas with a heavy Hispanic population where you see more stroke and diabetes is so much more different than the suburbs of Houston, where you have young families with growing kids and empty nesters whose concerns are for mammographies and colonoscopies and prostate screening. In rural Texas, where frankly providers are few and far between. This amendment recognizes that states, not Washington, should be able to tailor plans to meet the communities and families in each state. It also recognizes that people are unique as well. Let me just tell you what the critics will say today. The critics will say that Washington is abandoning important provisions in healthcare law, like mental health care or substance abuse or maternity care. But that is not true. What we are recognizing is each of these are important provisions to different people at different times in their lives. And it allows states to tailor the plans to provide those important provisions to their communities and their people at their times in their lives. We will hear today that this will allow junk plans and a race to the bottom. But I'll tell you what, the biggest junk plan is the Obamacare plan you can't afford and cannot use. And the race to the bottom is Obamacare itself, a program that is struggling, that is not long for existence, and will hurt a lot of people as it goes down. We'll also hear criticism that the CBO score is not available today. It's not, and that is a bit unusual. But it's unusual for the right reasons, because the Congressional Budget Office will no longer just survey Washington about health care. It will survey every state in the nation to determine what type of health care plans are right for them. Not right for Washington, what's right for them. They won't be talking and limiting their discussions to Washington, D.C. They will be surveying 50 states to determine what plans will be available to them. And what Congressional Budget Office will ultimately tell us is that more people will be picking up more plans because they're tailored to their needs. That this will cost some more money because more people will be using that individual tax credit for health care they actually can use and need and want. And so we are postponing the Medicare surcharge for a few years to make sure that more people can use that tax credit, and this bill remains a deficit reduction bill. Bottom line is, what's wrong with health care is that it's coming from Washington, that people in Washington believe they know best, that one size fits all. And frankly, if Obamacare continued, I think there'd be one plan across America, none of which would work. Today is about health care not driven by special interests. It's health care driven by what our families and our communities need. That's what's at stake here today. That's what this amendment is all about, and I urge its passage. Thank you, Mr. Chairman.
Thank you very much. Gentlemen, I'm going to defer to the gentlewoman from Wyoming. We're going to go in a little bit of reverse order today. She's taken time to be here every day. I sat in that seat for 9 years, and rarely did I get a chance to go first. So the first whack at the piece of legislation is going to come from the gentlewoman, Ms. Cheney. The gentlewoman's recognized.
Well, thank you very much, Mr. Chairman, and I just want to thank, again, the two chairmen for being here this morning. And I think there's something very fundamental, as we've been discussing for months and months here, about what we're doing. And as I listen to my colleagues on the other side of the aisle, you know, their assumption that underlies their questions and their challenges and their attacks is very much that the only thing that happens in this economy happens if the federal government orders that it happen. And that's fundamentally at odds with how our economy works. I want to ask you, Chairman Brady, you mentioned that we may be on the path here to just a single provider if we continue down this course, and I think that's a very important point. And as you look at what we're trying to do, can you talk a little bit more about the extent to which the changes that we're making are part of an overall effort to fundamentally remake this system so that people and states are in charge of their care? And talk specifically also, if you wouldn't mind, about the extent to which the charges that women are going to be hurt, that mothers are going to be hurt, that children are going to be hurt, is actually completely at odds with the reality of what we're doing. We're going to give people the right and the ability to purchase the insurance that they need and the resources to do so.
Well, let's start with that second point. This bill is, and this amendment, excuse me, is all about ensuring that states can design health care plans that are right for them and right for their regions. What it means is that instead of Washington demanding a list of 11 certain benefits, it empowers states to determine which plans and which populations need which of those benefits. And so beginning next year, Congresswoman, each state will determine what those essential benefits are for their state and for their plans. Massachusetts, for example, which has a full health care plan in place, may choose to retain all 11 for every plan. Well, that's their right. Wyoming, where sometimes towns are few and far between, where there aren't providers on every corner, and where there's hardworking ranchers, where those who work energy rigs and others may be in man camps, where there is a different population, Wyoming may instead choose plans that are right for those regions with the priorities, these benefits that fit those people in Wyoming, not from Washington, D.C. And what we know from what the CBO will ultimately analyze, looking at states, is that as a result of taking that power out of Washington, giving it back to the states and communities, that more people will choose plans that are right for them. So much so that we include funding here to ensure that tax credit is available to people in Wyoming. It is a fundamental, make no mistake, this is a fundamental change from Obamacare. It just rejects this Washington mandate. We all know best up here for that power of the people, and it's going to be critical. Those provisions, as you said in your first point, this is about making sure each of those elements are available to people who need them at the time in their life when they need them. That's so much smarter and so much more usable than what we have today.
Thank you. And Chairman Walden, you know, we've talked before about the extent to which we're not here debating two versions of the world that we haven't seen and that we have to think about theoretically. We now are living in a situation where we've seen their version. We've tested their version, and it's been tested at great cost and expense to many people around our country in terms of bankruptcies, in terms of a tax burden, in terms of skyrocketing costs and plummeting choices. Could you talk a little bit about the extent to which we've now seen that, we've seen the problems that have been caused by the government attempting to mandate care, and why it's so important that we'll now really be giving people choice and control and power over their own lives, their own insurance policy.
I appreciate your question and your counsel on these matters. This is really serious stuff. We now have a record of history of how this market, I think, established from the heart. They hoped they were doing something that would work. They just can't admit that it's failing. We can see that, and people in this market can feel that, and we're here to rescue them and stop this market from collapse. I've told people that, you know, if there were a different occupant in the White House and a different party in control of the Congress, they would be facing the fact that people in 1 out of 3 counties in America aren't going to have but one choice. That's called a monopoly in most markets. And in some areas, we've been told next year there may be no option. How can you sit on your hands? And the biggest amendment you offer, the most important amendment you would offer on a reform, you would think you'd offer it first. In our committee, we spent 10 hours debating the Democrats' first most important amendment, which was to rename the bill. 10 hours before we voted. That was, I mean, come on. This stuff's serious for people. That's why we're not dragging it out. We're trying to move forward. And my state, with all due respect, is probably about as blue as your state is red. And if I could just share, because I think coming from a blue state perspective, it's important to hear what my state said about exactly the amendment that's before us today. Not this exact amendment, but the concepts behind essential benefits. And the health authority there said the existing essential health benefits rules mandate that states choose a benefit package from a limited number of existing health plans. These rules prevent states from developing new and innovative plans that could incentivize prevention and improve healthcare outcomes through reduced or eliminated cost sharing for high-value services. They go on to write, we encourage providing flexibility to states to experiment with benefit designs that build on that access, flexible plan design that can help consumer choice while allowing insurers to moderate future premium increases. They make various recommendations basically to give them this flexibility, which is what we're proposing today. And they say without sacrificing access to comprehensive coverage, which they can provide and guarantee, as can every one of our states, they say regulation of benefit requirements should be delegated to state regulators. Regulation of benefit requirements should be delegated to state regulators. Now, my state's, well, it may be more blue than yours because you actually have a Republican governor. We haven't had one since 1987. My point is, governor after governor, Governor Ducey in Arizona, the insurance commissioner of Georgia, the governor of Maine, the insurance commissioner of Mississippi, my own, they're all saying, please, please, unshackle us. We know this market. We know our state. It's like my colleague from Texas said, different regions of my state may need different plans and opportunities. But we want to make sure that people have access to affordable insurance. We all share that goal. Let's not kid ourselves. We're finding and looking under every rock to say, how can we help drive down premium costs, give innovation a chance, and fix this mess? But we want to make sure that states not only have the flexibility and regulation, but have the funding in their accounts to attack the most pernicious problems we see. Opioid abuse being high on that list. And so we give states an additional $15 billion on top of $100 billion, on top of safety net funding for non-expansion states. We turn off the cuts on our hospitals that are called for under law, under the Affordable Care Act, quote unquote, under Obamacare, cuts our hospital funding. We turn off those cuts. We give flexibility. We think it will drive down costs. We do know this. That when the Congressional Budget Office looked at the design the last time, they were off, because this stuff is very complicated and difficult. I have great sympathy. I don't know how they do what they do. But the long and the short of it is they didn't get consumer behavior right then. I don't think they're getting it right now. And they were off by 2 to 1. Some 20 million people said, I'll pay the IRS a penalty rather than buy the insurance on the Obamacare exchange. So, you know, it's not working. Let's make it work. And again, the proposal before us today on essential benefits Nobody objected to when we did this to rescue the basically small business market of 51 to 100 employees. That was called the PACE Act. They all voted on it. Nobody in the House or Senate objected. Senator Schumer was a co-sponsor. My colleague from Oregon, Peter DeFazio, was a co-sponsor. I mean, we all recognize this was about to derail that small business market of 51 to 100. We said, please take it off. There are no essential benefit requirements on the large group market where 155 million people get their insurance today. So nothing affects them. 61% of Americans get their insurance through their employer. Most of them are already exempt from this mandate. The only place well, not the only place, but the biggest place it applies is in a market that, by the way, coincidentally, is collapsing. And this is a contributing factor to that collapse. So let's take off the pressure, respond to our states, give innovation a chance.
Thank you very much, Mr. Chairman. And I just want to say, echo what you've said, that although we are very heavily engaged in debating and discussing policy matters and discussing how this will affect insurance markets and how it will affect Medicaid, at the end of the day, all of us know that people are at the heart of this, and people's lives are affected. And what our speaker has said is absolutely the case. This is an act of mercy. And what we are doing, and certainly in my state of Wyoming, we are anxious and ready, and we welcome the chance to finally be in a position where we are making determinations about our health care, about what makes sense for us, and where individuals across our state have the power to make those decisions and choices. So I'll just close by saying I could not be more honored that this is one of the very first things that I get to do as a member of this body. It's something that we will remember proudly, I am confident, and I look forward very much today to being able to vote on this very important piece of legislation. With that, I yield back.
I want to thank the gentlewoman for hitting the heart of why we're here this morning, and thank her very much. Gentleman from Massachusetts.
Thank you, Mr. Chairman, and I thought we were going to just have the gentleman explain the amendments, but it seems like we've kind of reopened the hearing, so I think we'll have a few questions on this side. Let me begin by simply saying I appreciate you being here, but I'm not convinced. With regard to mental health and substance abuse services, the bill eliminates the guarantee of coverage and treatment and replaces it with the slush fund that states may or may not use, which may or may not provide care where you live, which may or may not be affordable. And states would have to match what the federal government puts up, shifting more and more costs to the states. And additionally, you guys cut nearly $900 billion out of Medicaid. With regard to maternity care, I mean, the amendment includes a slush fund for states that can be used for maternity and newborn care. You mentioned that in your opening statement. But pregnant women and newborns need health insurance that covers maternity care, not a slush fund that may or may not be used for health care services. And even if a state decides to offer maternity care for a period of time, what does the uninsured woman and her child do when the period of time expires? So I worry that the bill that is coming before the House today will return us to the days when insurers sold woefully inadequate policies with few protections. Ms. Cheney says, kept on, I want to say to Ms. Cheney, I saw your version of of health care. We had that before the Affordable Care Act. And just for the record, before essential health benefits, only 12 states, only 12, required maternity coverage, and only 17 required mental health coverage.
Would the gentleman yield for a
Happy to
moment?
yield.
As the only member of this panel who actually has ever needed and used maternity care, I'd like to point out how crucially important it is for women and for mothers to be able to see their own providers. And when the state mandates that those who are not in need of care actually have to purchase care, the result of that is, in many instances, women not able to see the doctors they would like to see for their own care.
Well, and what we knew from before was unaffordable costs for many women who needed maternity care, which was unacceptable. And so I don't think that's the flexibility that we would want to see, where states deny people the kind of coverage that they now have and that they rely upon. So let's not have a race to the bottom when it comes to Americans. I have no idea. I mean, we're going to, my colleagues have come here to kind of to spin what is the latest version of this bill. none of us going to really know truly what's in this bill for some days. You know, I saw an interesting quote from one of my Republican colleagues, gentleman from New York, Mr. Collins, the Buffalo bribe guy who came before here, and the quote is, this is, I'm quoting him, he said, there is, quote, misunderstanding, end quote, of the health care bill. But once it's passed, quote, we can have the chance to really explain it, end quote. So we're not going to explain it before we vote on it and debate on it. We're going to explain it after you vote on it and potentially pass it. I don't know. I don't think that's the way we ought to proceed here. You know, this amendment, you know, is 4 pages, as has been pointed out. But I have to say that it's probably the most dangerous 4 pages on the planet if it does what we think it does. And I guess my question to both of you at this particular moment, because I assume this will be the last Rules Committee we have on this bill. I hope it is. But it's about the process. I mean, I'm just curious whether you're proud of a process that hands a substantial amendment and change to the bill at 10:30 at night. We see it last night. We gather here at 7 in the morning, not being able to digest all of the implications of that amendment. There'll be no CBO score, as you pointed out. And we then go to the floor and then vote on it. You know, it just seems to me that, given the fact that you voted for a martial law rule that will keep us here till Monday, to bring up anything you want between now and Monday, I don't know, I mean, you could have waited until tomorrow. You could have waited until Sunday. The Senate certainly is not going to meet over the weekend. Could have waited until Monday. But it would have given an opportunity for there to be more transparency. And, you know, I don't want to belabor this point, but I think that I'd like to get your opinion whether you're proud of this process that we're engaged in. Maybe
Well,
you are.
If I may,
Yeah.
you know, I will just tell you my experience in the Ways and Means Committee 7 years ago, just about now, under Speaker Pelosi and Chairman Rangel. We were given a 800-page bill the evening before.
Excuse me, Mr. Brady. I didn't ask you about
markup,
7 years ago. I asked you about last night.
300-page manager's amendment at midnight. Votes start at 9 o'clock.
Does that mean no?
This is a 4-page bill. It includes provisions this House has already considered and passed, as Mr. Walden has made clear
So
before.
I'm assuming that that's a yes,
so
that
if-
this is a process that you are proud of.
I am very proud
Okay,
that
good.
we are wrestling power out of Washington
Yeah.
and giving it back
Well,
to the
yeah.
states and communities and patients
Yeah.
who deserve it.
Well, I'm willing to bet that there are not just Democrats, but Republicans watching this process who are ashamed of the process, and I include myself in that. This is not the way we should be bringing a bill to the floor that is going to adversely impact millions and millions and millions of Americans. And the changes in this 4-page amendment are substantial. I mean, these aren't minor changes. And, you know, I mean, if there was a hearing, I think we would hear some of the concerns about the impacts that would have. Mr. Walden?
I understand why you're ashamed, because you were for the principles of what we're bringing before you. Before today, you're against them, because you didn't object when we passed the PACE Act, which did exactly for that small group market of 51 to 100,
Yeah,
what we're doing here to give flexibility to states. So I'm sure you're conflicted
Well,
with that,
I-
but that's what we're doing today.
I have a...
What changed? What is it that you were for it? In fact, your state adopted the principles of the PACE Act because they saw it was good for small business.
I have a different recollection of that, Mr. Walden.
Well, the legislative
I just
record's the
want- I
legislative
just want to say
record.
here, look, if you guys, you know, are proud of this process, that's fine. You know,
I'm proud of the product.
And if you,
Mr. McGovern,
yeah,
would
I
you
yield to the
just
gentleman.
Yield for just one comment with what changed is $1 trillion in tax cuts and $800 billion taken out of Medicaid. Thank you, Mr.
Yeah.
McGovern.
And, you know, and I guess we'll follow Chris Collins' advice that, you know, there's a misunderstanding of the healthcare bill, but once it's passed, we'll have a chance to really explain it.
Will the gentleman yield?
Happy to yield to the
I
gentleman.
mean, it sounds like Mr. Collins is saying, if you pass it, then people can read it and figure out what's
guess
in it.
that's what he's
Is
saying,
that
you know,
essentially what he's saying?
You can understand what the.
Sometimes you need to pass something to know what's in it, I guess, is what.
And maybe
Republicans are saying.
we'll be able to find out more, if there are more little goodies like the Buffalo bribe in the bill. But any event, I just, you know, as I said at the beginning, I can't adequately express how horrified I am with this process, and especially on a bill that is going to have such a negative impact on people. And anyway, nothing we can do here. I yield back.
Jim yields back his time. Thank you very much. The gentleman from Oklahoma, Chairman Cole.
Thank you very much, Mr. Chairman. Just quickly, just for the record, how long is the base bill? How many pages?
100 pages or so?
It was 117.
Yeah.
Yeah, something like
Not the
that.
2,400.
How long are the amendments collectively, this one and the ones that we've dealt with?
Well, the last one was a couple dozen pages,
And how much time have we had to read this material?
4 pages
Well, and,
today, since
And the
yesterday.
100-odd pages?
and by the way, it's only 3 pages and a line and 2 words on the 4th
And how
page.
long was Obamacare? How long was that?
2,400 pages.
Okay, well, I just wanted those things in the record as to what's hard to read and what you can actually get through and comprehend. I don't think there's any excuse for every member of the Congress, no matter where you are on the issue, not have had time to
Right.
read this bill. We've been talking about this issue for multiple years. As both my friends pointed out, these things are full of things that have been voted on time and time and time again, scored over and over and over. And frankly, I do know when we do get the CBO, and we all wish we had it, that score will continue to show that this reduces the deficit. So, we can debate how much, but we know it's going to be lower if this is passed, I think we're broadly. So I'm not going to spend a lot of time here. I don't need to ask you guys a lot of questions. I've spent a lot of, on multiple subjects, a lot of early mornings and late nights with both of you over the years in a lot of different capacities. And I got to tell you, I've never been prouder of both of you in the way you've led your respective committees and the product you've brought before us, because I think you've brought a product before us that keeps our commitments, keeps our promises, opens options. And again, I know what's in front of my state. I know that our rates are going up 69% under Obamacare next year.
right.
I know that we have a single provider. Thank God we have one, because I'm not sure in another year we will. And I look at what's in front of me, and I see, frankly, an option for every single person in my state to have a tax credit to begin to build a plan that they would like. I see choices and competition, and I see some hope. And I know this product has changed, and I think gotten better under you guys' leadership and the participation of every member of certainly our conference over the last several weeks. I want to commend the President of the United States for being part of that process, and our leadership for being part of that. But I understand very clearly what's in front of me. I think most members do. And I think you've given us an opportunity here to move forward, move in the right direction, be consistent with the things we've run on. So don't have a lot of questions.
Can I just, Mr. Cole, if I might, I just want to thank your governor, our former colleague, Mary Fallon, who wrote to us and said, here's some things that would help Oklahoma, here's some things that would help America. And one of the things she said is relax or eliminate the federal plan design elements, such as complicated metal tiers and their underlying actuarial value ranges, essential health benefits, age rating, community rating areas, multi-risk mitigation methods. Instead, allow state control of a minimum core set of operating principles, including insurance plan actuarial values, benefits, rating, and risk mitigation methods. This is what we're doing. And I came out of the private sector. My parents came out of the Depression. I was taught to work hard. And I'm willing to work day and night. And I spent a lot of weekends in my own business working day and night to solve problems. We had a transmitter that burned out a tube. It didn't wait till Monday. You got in there at 2 a.m. or whenever, and you replaced the tube. And that's what I feel like I'm doing here today. I'm willing to stay here and work day and night and over the weekend to solve this problem, and every one of us should be willing to do that because people are suffering out there. We're going to fix this market together.
Well, my friends have been doing that, and again, as I said, I'm very proud of both of them, very proud of the committees that they lead. We're not a very big state, but I guarantee you we'll put every vote we've got on the board with you guys today. So thank you very much for your service and what you've done, and look forward to working with you today and hopefully to a successful conclusion. With that, Mr. Chairman, I yield back.
I thank the gentleman and would offer just a vision. Oklahoma's a great state and a great neighbor. And when we've been in trouble in Texas, especially in drought, Oklahoma hay helped us out. So thank you very much. The gentleman from Florida, Judge
I thank you
Hastings.
very much, Mr. Chairman, and I thank both our witnesses as well as all of us that are here this morning. I want to set the record straight on a couple of things. I guess we're going to go to the floor at 9 or thereabouts, but if y'all want to keep on talking, then I certainly will do the same thing. I would say to my very good friend from Oklahoma that it doesn't matter how many pages you can have a paragraph that can do as much damage as 1,000 pages. And in this instance, these 4 pages, and in this second-degree amendment for the manager's amendment, establish, in my considered opinion, some of the most egregious dangers that are likely to come down the pike. And also, let me set the record straight about something. I ran for Congress in 1992, and myself and 3 opponents in that election, and the Republican opponent, all advocated that we should have universal health care. Now, it's the nature of the district largely because of the significant number of seniors that are there and the significant number of poor people. But I believe if we really want to solve this problem, if we really want America to have a system, then whether you like it or not ideologically, a single-payer system would benefit physicians, insurance companies, hospitals, and all the people that we're talking about. But you never intended there to be a health plan of consequence for this nation. You're the same people that didn't support Social Security. You're the same people in large measure until it became ultimately beneficial, and now you still want to change it. So don't give me that grumble in the background. You didn't care anything at all about Medicare that much until people started liking it, and some of you did vote for it back in that period of time. But you sure enough don't like Medicaid. And let me go back to you, Mr. Chairman, and straighten you about my governor. I made the statement to you that my governor did not expand Medicaid. I was correct, and you were correct, when you said that he initially offered that we should expand Medicaid.
Yes, sir.
But he flip-flopped. When the Senate had a bill in the state of Florida that would have expanded Medicaid, he did not raise his finger to do one single solitary thing about it. So Medicaid has always been a problem in Florida, and what we wound up doing was leaving 900,000 people in the lurch in the state that I'm privileged to serve. You all now talk about block granting Medicaid. Let me go back a few years to when Mike Bilirakis, Gus's father, both I adore, was here. Mike was on Ways and Means and managed to assure that $300 million that went to Florida was going to be block granted. And much of that money went into the general revenue and did not go to help poor people. Now, when the deal is done here, what we will have done is help rich people. And we will not have helped poor people. So the question that I have for you two gentlemen is, do you believe in the CBO score? They've recently issued one on the 23rd, which ultimately, in essence, says a little bit about the same thing that they said in the earlier one, but now we're getting ready to go to the floor without it. So do you all believe that these 200 people that we are paying nearly $50 million a year, and I might add, last time I looked, the chair who our HHS secretary engineered to become the director, is a Republican named Keith Hall. So do you guys believe in the CBO, notwithstanding how difficult it is to protect the future?
I would say we're not asked to give our belief in the
Okay.
CBO.
Uh-huh.
What we are required to do is take that information and be informed as we move forward. And what the CBO
Okay, then
clearly
let me give you,
said was
some of
that
the
so many
information.
Americans,
Let me give you some of the
given
information.
the freedom to not be forced into
Reclaiming my
healthcare,
time, Mr.
will
Brady.
choose not.
Mr. Brady, I reclaim my time. The CBO and the Joint Committee on Taxation estimate that in 2018, 14 million more people would be uninsured under the legislation that is more than under current law. Do you agree with that?
I agree that 11 million of them, freed from Obamacare mandates, will choose not to buy health care they don't want and can't afford.
The increase in continuing on from CBO, the increase in the number of uninsured people relative to the number under current law would reach 21 million in 2020, 24 million in 2026, and in 2026, an estimated 52 million people under age 65 would be uninsured, compared with 28 million who would lack insurance that year under current law. That's from Keith Hall, the director of CBO. Do you agree? In part, do you think any part of that is a fact? Mr. Walden?
Well, if I could just respond to two things, and I will respond directly to your question, because no, I don't agree. But the second part is the insinuation that we don't care about people on Medicaid. I'm offended by that. I reject that. And I think because the member does not know my history in terms of working on this issue in Oregon, when I became majority leader, I created a select committee, bipartisan, to implement and expand Medicaid coverage and help for those in the low income. It's called the Oregon Health Plan. It had been passed before, and we expanded it. I've worked on these issues to expand access to care in a rural
So
district.
Greg, then tell me
And I'm
about the $800 billion that's being taken out of Medicaid, when in fact, all we had to do was leave the taxes that are here for very wealthy people. 400 people are receiving a substantial increase in their taxes.
I know.
And desperately don't need it. Do you not see how that affects Medicaid?
Okay, I'm going to try and bring the tone down here
I'm
just a
not
little
going to
bit.
bring my tone
All right.
down. I'm mad as hell about what you all are doing, and I don't have to be nice to nobody when you're being nasty to poor people.
Well, let's take this one at a time, because you asked me about the CBO data. I disagree with it. The reason I disagree with it, in part, is because it's difficult for them to make these calculations. As you recall, their prior indication for 2016 was off by about a 2-to-1 ratio. They thought 21 million people would be on the rolls. It's 10.4. So I think they have a difficult time understanding how the market will respond.
Right, let me respond to you with reference to that. Among the reasons that they made that miscalculation was the fact that a substantial number of Republican states chose not to involve themselves in Medicaid.
Well,
and that had an impact on the number of people that CBO had calculated.
Can I address that?
Of course.
So actually, that number I gave you are those on the exchange, not on Medicaid. This was looking at how many people would sign up for the insurance product under Obamacare. And remember that I think the number is 9 million that paid the penalty or took the waiver. 6.5 million in 20, yeah. Okay, I just want to make sure I got my numbers right. 6.5 million paid the IRS a penalty of what, $600-700, saying, I don't want that product. And another 12 million or so got an exemption. So all I'm saying to my dear friend, this market isn't working for these people. And we want to get it to work for them so that they...
Let me say, my dear friend, do the Republicans absolve themselves from any responsibility for the fact that the program itself did not work, when in fact, for 7 years, and including just recently, you hammered this particular measure and sold it as something that would fail rather than work to do anything that would make it be successful.
I appreciate the gentleman's question, and actually I would again take issue with it, because this Congress, in bipartisan ways in almost every case, worked to solve the problems as we went along. We passed 20 pieces of legislation that President Barack Obama signed into law dealing with fixes and changes to Obamacare. There were 4,775 Democratic votes to do that. And so together over the years, now what we did plead for the entire year of 2010 in the Energy and Commerce Committee, we put 13 requests into then Chairman of the Subcommittee on Health, Mr. Pallone, to just do an oversight hearing about how this law was working. There were no oversight hearings until we got into the majority. Then we said, there are problems, let's work together to fix these problems, and we did. And we passed 20 bills that became law.
And you spent a whale of a lot of time seeking to cause the measure to fail. But now you put a lot of things in here to try to make this bill seem less horrible than it really is. The fact is that even though you add $15 billion for mental health and substance abuse fund, I find it interesting that a portion of that is called slush. I know what happens with slush funds in states and here. And you're gutting coverage for the largest behavioral health payer, Medicaid, which contributed more than $67 billion for behavioral and mental health in 1 year. Let me ask you, do you all agree that this measure provides $1 trillion in tax cuts for primarily wealthy people and corporations?
No.
How much does it provide?
It provides $1 trillion in tax relief to families who buy health insurance plans, patients who buy over-the-counter medicines, small businesses who can barely afford health care for their workers, and for companies that have seen their jobs move overseas because Obamacare has taxed them out of business.
I see. So the 400 wealthiest people in this country don't receive any benefit from this?
No, I didn't say that.
I'm
said
asking you.
millions of Americans
I
receive
see.
benefits
All right.
from.
So
Washington taking less.
Do you agree, and I made the statement when we started this, that there were, in my considered opinion, that's why I favor single payer and universal health care. One person not having adequate insurance is too many. But do you all agree that some people, never mind whether CBO says 24 million, you argue whatever you do, that if your bill becomes law, that some people, some millions of people will be uninsured? Do you agree with that?
Well, I would agree with this, that if we do nothing, there will be more people falling out. Because these markets collapse and you're not going to have a chance to buy insurance.
But we don't have to do nothing.
So that's exactly right. I agree with you. That's why we're here today.
I represent as many people as you do. Every member here represents virtually the same number of people. And I believe those people want all of us
To work together.
I've said that we should be locked up here
Right.
until we get a measure. Now, we know that the bill provides $274 billion in tax cuts for the highest income people in this country. You can name it anything that they're doing. Let me ask you whether or not your bill, as presently before us, increases premiums 15 to 20% in the next 2 years.
Over the next 10 years, it decreases.
I'm asking you about 2 years.
According to the CBO estimates, they believe that that will occur. But in the amendment today,
So you like
they will
CBO.
make clear that lower health care, more affordable plans will be used by more Americans, which is why we provide the funding for more Americans.
And you also make that
Pick up
fallacious argument about when the people got the money, the rich people, that it's going to somewhere or another get to the poor people, and it's going to create this great economy. And you're got in this measure, go to work if you receive Medicaid persons and you're able-bodied. And I agree that able-bodied people everywhere ought to be working. But I also think that government, both state, local, and federal, should be the employer of last resort, because all of us know that there are no jobs. and therefore it's going to be exceedingly hard for people to get work. I want to end this way, Mr. Chairman. My friend from Wyoming spoke of the Speaker's notion that this bill is an act of mercy, and I quote her, quoting him. I didn't hear him say that. But I want to give you just a few organizations that don't believe it's an act of mercy. Easter Seals is greatly concerned that this removes the federal funding guarantee that currently exists in Medicaid. The United Methodist Church says the bill has been promoted as a fix to the health care system in the United States, but it will do nothing to improve access and affordability. Instead, it will harm many congregations and communities in which we live and serve. People will die because of efforts like this to roll back health care. The Episcopal Church says this current proposal falls woefully short of our spiritual calling to care for the least of these, as well as the noble values upon which our great nation was founded. The Catholic Health Association of the United States says we strongly encourage the full House to reject this replacement bill and work to craft legislation that addresses the real issues without creating unneeded chaos in the system and coverage for those who need health care. The Washington Interreligious Staff Community, they say the scriptures of the Abrahamic traditions of Christians, Jews, and Muslims, as well as the sacred teachings of other faiths, understand that addressing the general welfare of the nation includes giving particular attention to people experiencing poverty or sickness. For their sake and for the common good, we must continue to make progress toward a U.S. healthcare system that is inclusive, equitable, affordable, accountable, and accessible for all. The millions of people who could be affected deserve proof of comprehensive replacement that would protect their access to coverage. Changes to the ACA or Medicaid will impact the health of millions of Americans. And I won't bother to go further, but I wanted to end by using Sister Simone Campbell, the Network Advocates for Catholic Social Justice. She says, after reviewing the House GOP replacement bill, the answer is a resounding no. Instead of providing greater health security, the bill increases costs for older and sicker patients and drastically cuts the Medicaid program, all while providing huge tax cuts to wealthy corporations and individuals. This is not the faithful way forward and must be rejected. I've said to you before that you're going to own this mess, and I wish it wasn't that way. I would be willing, and I believe many of my brothers and sisters here in Congress would be willing to work with anybody to do what all of us know we can do or should do. I yield to the gentleman from Massachusetts.
Yeah, again, I found it interesting that the gentleman from Texas referenced the CBO at one point. There are 200 employees who work there. We spend...
Yeah, they're awesome.
They are. They're great people. They do wonderful work. We pay $50 million a year to fund that, and yet here we are, and we're not, we don't have a CBO score or a report or estimate on the latest bill. I just wanted to mention remarks by a colleague of yours and not mine, Representative Mo Brooks, a Republican. He's on TV right now, apparently, and this is what he said. He says, "It's one of the worst bills I have seen in my 30 years," end quote. Who says Congress can't be bipartisan anymore? There's strong bipartisan opposition to this bill, no matter what new backroom deals you've struck. And, and I think you're going to be surprised that amongst your own membership, how many people are not going to be there for this. Some have objections on the right, and some of the more moderate members are horrified by the rollback of protections on essential services, but there is bipartisan opposition all throughout this country against what you're doing, and I thank the gentleman.
I thank the gentleman. I yield back.
The gentleman yields back his time. Thank you, Judge Hastings. The gentleman from Georgia is recognized.
Yeah, Mr. Chairman, I want to confess that I may misunderstand the meaning of the word backroom deal I've not been down at the White House, but I've seen absolutely every televised presentation of that. I haven't traveled to any of the back rooms, and I feel like I'm pretty well informed about what's going on, rather than being something that's done in the privacy of a room. This is something that has played out in front of every single one, not just of us, but of my 700,000 constituents back home, and I'm grateful for that.
Can I just say, when they crammed Obamacare through here, they also refused to allow cameras in the Rules Committee. It was the Republican majority that allowed the cameras in the Rules Committee to allow your statement itself to now be shown to your
Would the gentleman yield for 1 second?
Be happy to.
Yeah, that's a back room right there. You just came out of there, and I wasn't invited into that room, neither were any of the Democrats. So that's one of the back rooms.
I appreciate,
Gentlemen.
I appreciate the gentleman observing it. I'll tell you what we were talking about in that back room, and if you take issue with it, fair enough. We're talking about a 4-page amendment today that requires the Patient State Stability Fund to focus more attention and more money on, let me make sure I have this right, maternity coverage and newborn care. I think that that's something we believe in. I think this is yet again something that's made the bill better. It goes on to require that mental health and substance use disorder services be included in that fund. It goes on to focus on both inpatient and outpatient treatment of mental illness and addiction. My friends, I agree with my friend from Florida. I wish we could have done this in a collaborative way, and candidly, I believe that there was a possibility. I don't blame the gentleman from Oregon, but I must say to the gentleman from Oregon, when your committee spent hour upon hour upon hour dealing with motions on whether or not to change the name of the bill.
It was one amendment, and it took 10 hours of debate before we voted the first time.
I'm not going to try to characterize whether that was a Democratic delay effort or an effort to improve the bill, but those are the kinds of things that make people think we can't do it. And it could just be that this environment is too toxic on this one bill. We all know the history here, but I want to agree with my friend from Florida. He was quoting folks writing in on the bill, and he said this bill, the changes in this bill will impact the health of millions of Americans. And I want to stipulate that that is true. It's true across the country. It's certainly true in my district. It is going to impact the health of millions of Americans, and it's going to do so in a dramatically positive way. I'll give you just one example. I told you about a CT scan. I asked you if you knew what one ought to cost. I went out and did some research afterwards. We're talking about state flexibility here. It turns out I can drive right down the road here in D.C. and have that CT scan done for $1,900, about 5 minutes down the road. I can drive across the river into Virginia. I can have that same CT scan done for $900. Or I can drive 25 minutes down the road to Maryland and have it done for $98. $1,900, $900, or $98. When you free up my state to construct a program for our people in a way that provides flexibility to unleash that kind of market information, you make changes that we cannot we cannot know today the limits of the positive impact that will have. I'm looking forward. I understand that CBO has a lot of work to do. I'm looking at these 4 pages and the changes that they make. I'm not an economist, but there's no set of circumstances where this language does not result in better coverage, better care, and more insured individuals in my great state of Georgia. But I really am grateful to you for not focusing on how many folks have insurance.
Would my
instead
colleague
focusing-
from Georgia, when he finishes, yield?
Be happy to yield to my.
Yeah,
But instead focusing on how many folks have access to care. The essential benefits package as it exists today can have a $7,000 copay for every individual in America. And I tell you, for constituents in my district, it does not matter how many benefits you put in the essential benefits package. If they have to pay $7,000 to access them, they are worth nothing to them. nothing to them, and you provide the flexibility here for Georgia to craft a program that serves these underserved populations. It is not about who has a card in their pocket. It's not about what the line of legislation says. It's about whether that child in my district can have access to that care, and you do this for folks against withering criticism. And I'm grateful to you for not giving up, because it would have been easy to give up, and my folks.
Mr. Chairman.
Gentlemen, I would just say, I want to go back to what you started with, which is the disparity of costs for procedures and the lack of transparency. Because I think the thing I'm most concerned, I think most people are most concerned about when they do have insurance, I mean, you've got to figure out this insurance market and all, but is, what are these cost drivers? And for the life of me, I can't understand how one place it's $1,900 and another place it's $98, but beyond that, we probably don't know. As consumers, there's no easy way to figure that out. I want the tonic of transparency into this healthcare process. I want to drive prices down. I want to increase consumer choice, because an informed consumer is going to have the most effect at driving down price in this market, because that's what competition does everywhere else, except in healthcare, where it's so opaque. You have to have all the resources of a member of Congress to figure out the best place to go to get the best deal on an MRI. So I appreciate the gentleman.
Chairman, just a point of inquiry.
Would gentlemen hold?
Yeah, I mean, it appears we're having a hearing now, and I guess I think what is troubling me is that it's very one-sided. We have two Republican witnesses, but we don't have any Democrats here, and
I think we gave the opportunity for you to have.
Well, maybe we should call them, because I think at this point, it looks like it's turning into a hearing, so I think we ought to maybe see whether that might be something we ought to do.
I had asked my colleague to yield when he finished.
As soon as I get the time back. I'll be
Understood.
happy to. But said to my friend from Massachusetts, I think you're absolutely right. I had not intended, I thought you had said as long as you had the time, you were going to go ahead and have the hearing, and I should not have followed your lead. But to my friend from Florida. Your statement.
Excuse me, I want you to, I followed Ms. Cheney's lead, thank you.
But I stipulated it.
You mentioned, and all of us have the same sympathies, I'm sure, that you want that child to have access. There is a distinction between having access and being assured, and that's what we don't have. Here's what I wanted to do. I failed when I talked about the CBO, and so far we've done that, and I just wanted to ask you to yield so I could ask the chair to allow the present March 23rd iteration of CBO to be made a part of the record.
Without objection, we'll enter that in work. Thank you, Judge.
But that's for yesterday's version. We don't have one for today.
That's right.
Okay,
This is
thank you.
March
All right,
23rd.
Thank you.
And Mr. Chairman, in true bipartisan fashion, I'm going to accept Mr. Govern's advice and yield back the balance of my time.
Thank you very much. Gentleman yields back his time. The gentleman from Colorado.
Thank you, Mr. Chairman. I think it is very important that we are since we're the only House committee to have any kind of hearing on this new amendment, it's very important for us to take the time we need to do our job. And I do want to confirm that we are in this, and then I have one or two questions on the other stuff. We just got the CBO score, and I want to move on to the new amendment. This new amendment, did this new amendment, did these things come up in either of your committees? The delay in the repeal of the Medicare tax, the removal of the essential benefits, or this additional support for the Patient and State Stability Fund? My question is these new concepts you're bringing before this committee, or are these at least three things in this new amendment also debated in your committees?
Yes.
It is new to us, or?
No, they were debated at the
They were debated in
committee.
committees? Mr. Brady?
Yes, they were, both the Medicare surcharge and Mr. Neal, our ranking member, offered amendment related to essential health benefits itself.
So, okay, so we're the first committee to actually see them in amendment form, or were they offered an amendment for neither of your committees as well? You mentioned the Medicare delay was?
So the Medicare surcharge for wealthy individuals. That tax was offered as an amendment in the committee and has been a subject of hearings throughout the years in our committee as well.
Mr. Paulus, we had an amendment on EHB-related issues. It was debated and I believe defeated.
Okay, so before I get to the new amendment, I have a couple, two things about the bill itself. One is, as you know, we just got the CBO scoring on what is now the old new amendment, the manager's amendment that we first saw a few days ago. One of the surprises in that is that it would increase the deficit substantially over the original bill, about $187 billion in additional deficit over the original bill.
The bill is not a deficit bill. I mean, it is a deficit reduction bill.
Well, yes, you can express it in different ways. You can say this reduces the deficit by less, but at the end of the day, the deficit would be $187 billion more under the manager's amendment than under the additional bill, under the original bill. That's what the scoring said that came back, and I think that.
Would you like to talk about why?
Well, I'd be happy to in a minute, but one of the great surprises of that is that while increasing the deficit by $187 billion, it actually doesn't cover any additional people. I mean, that seems very hard to do to me. I don't even know if I could do that if I tried. If you're going to increase the deficit by $187 billion, you think somebody would at least get coverage out of it. So I'm happy to yield to see where all that money is going. That is increasing the deficit by $187 billion more under their manager's amendment than it would be under the existing bill.
So, of the $186 billion, $140 billion of it is tax relief, accelerating that off of people who buy health insurance, over-the-counter prescriptions and medications as well. And the bulk of it, though, is tax relief for Americans in that 50 to 64-year-old age group who oftentimes can have higher medical costs. The decision was made across our conference to do more to help them ensure affordable health care, the broadest range of plans, which this amendment, by the way, helps ensure more affordable as well. And then the remaining $40 billion was more resources that was provided through Medicaid for a number of people, frankly, who are vulnerable in nursing homes. And we want to assure have additional resources. Mr. Walden, is that correct?
That's correct. And so we've listened to people who said, and we looked at the last CBO score and said, you know, there are ways here. We need to make this even better than it started out, and that takes money, and we put it in here.
Yeah, well, but at the same time, you're increasing the deficit by $187 billion.
Well,
the Congressional Budget Office scoring
It
shows
reduces
that
the
while
deficit.
your goals
Yeah.
may be noble, it doesn't extend coverage to any more people. The same number of people lose coverage, the 24 million under the manager's amendment, which we have the scoring back, is under the original bill. So while perhaps your policy goals were laudable, it didn't seem to reach them. You would have been better off just giving people free insurance with that money. If you wanted to cover more, at least it would have covered 1 million or 2. But somehow you seem to have covered no additional people with that increased deficit spending.
Well, free
I
insurance
do understand
has
your
worked.
rhetorical point. These are levels of reduction in the deficit, but at the end of the day, you can't disagree with the scoring. Well, I mean, you can disagree with it on the merits, but you can't disagree that it says that under the manager's amendment, the deficit would be $187 billion more than under the original bill. I also wanted to ask Mr. Walden, you mentioned that you discussed the essential health benefits in committee. It's my understanding that there was an amendment on essential health benefits that was actually defeated in committee. Is that correct?
That was my answer to you, yes, sir.
Okay. Now, it's not, certainly not against in any way House rules, but I do want to point out it's unusual for an amendment that was defeated in committee to be then put back into a bill outside of regular order in a manager's amendment. It does happen. I'm sure you can find some point in history where Republicans and Democrats have done it, but I want to point out that that is unusual when there was a bipartisan vote that defeated an amendment in committee, that it was taken out of the ether and put back in the final
No,
bill.
could I respond just for accuracy? It was a different amendment. Mr. Kennedy's amendment was different than what's before us today.
Okay,
I said it was related to EHBs, because you asked if this issue was debated.
Yeah.
I'm sorry if I wasn't clear on that, but it was related to EHBs.
What's that? Which one hasn't been seen? Okay. Well, I don't know. The note I have says that the Essential Health Benefit Committee was defeated in committee, and you're putting it back in the bill. I think what you're saying is there's some differences between this amendment and what was offered in committee, but it's.
I'd be happy to get with your staff or have our staffs get together if you'd like to go through the specifics.
Okay. Now, getting on to the new amendment, actually, one more question on the bill. A surprising number of my constituents ask what happens to members of Congress and our staffs under this bill, and I was hoping you could address that.
I believe there's no change. I'm in the DC Shop Exchange, which is the Obamacare market. Mr. Hastings is. I don't know about others.
Well, one of the provisions of the
in
Affordable
that.
Care Act is it removed members of Congress from the federal health care benefits. If that part is being repealed, is there anything in this bill that would guarantee that members of Congress wouldn't go back on federal health care benefits?
Yeah, I know this is complicated stuff. We don't repeal the exchanges. We remain in the exchanges. Members of Congress, I think, should stay in the exchange.
Staff.
And I'm in the exchange because, we should feel the same pain that our constituents have felt that are in the exchange. And, rise or fall based on our policies. And so I'm in the exchange. I have a Blue Cross policy in the DC shop. I was forced into it.
Gentlemen, yeah,
Happy
just
to
one
yield to the
minute.
gentleman.
Interestingly enough, a lot of our constituents believe that we don't pay for health insurance.
Oh,
That's not an argument, but I hear that all the time, that we have free health insurance.
Oh, yeah.
So let me just alert America.
Thank
that
you.
we pay
We
without the
agree.
exchange.
Well, yeah, and as I said, many constituents inquired about this, and I wanted to ask about, again, whether there's anything in the bill that would prohibit members of Congress or our staffs from being put back on the federal benefit plan.
I don't believe we change anything
No, there is
relative
no
to that. No.
So you leave the part of
It's
the.
as it is. We
Don't
did,
repeal
no
part of the-
special backroom deals for members of Congress in here.
So
or
you're
our
not
staffs.
repealing the entire Affordable Care Act. You're keeping some elements of it, like the part that
Yes.
members of Congress off of the federal employee benefit.
We stay in the exchange, and we'll rise or fall based on the policies we're putting before the Congress, just as our constituents. I think that makes sense, by the way. I think we ought to be tied to that. And if our policies aren't good, we're going to pay the price, too. We think they're going to be better, by the way, and actually drive down costs.
Well, on that topic, going to the newest amendment, which I would point out, I think most members of Congress, myself included, just saw this morning. I understand it might have been posted late last night after some of us went to sleep, but I saw it for the first time at 6:30 this morning. We probably have colleagues that haven't yet seen it because it was just posted. When you're talking about eliminating essential services, what you're talking about eliminating as part of every insurance plan is ambulatory patient services, emergency services, coverage for hospitalization, coverage for pregnancy, maternity, and newborn care, mental health and substance abuse use disorder services, that's the mental health parity piece, prescription drugs, rehabilitative and habilitative services, laboratory services and testing, preventative and wellness services and chronic disease management, and pediatric services. That's from healthcare.gov. Those are the essential services that, for something to be considered insurance, it has to meet, which would be eliminated under this. My question is about the other piece, the Medicare tax. It's my understanding that this manager's amendment, which again, we're just seeing for the first time, would increase the Medicare tax by about 1% for 5 more years over the original bill. Is that right? 5 years, yeah.
It continues the existing
Right.
tax.
So it taxes more than the original bill, just to be clear. And it seems like a lot of that money is going into the new entitlement program or the slush fund to the states. Is some of it also reserved for deficit reduction in this plan? I know we don't have the CBO score, so I'm asking for back of the envelope. When you take the revenues from the tax increase in this new amendment, you subtract out the additional money you're sending to the states, are you anticipating that there would be additional deficit reduction under this bill?
So the bill will be $150 billion of deficit reduction. Now, in the amendment, because we are providing for more use of the health care tax credit, because there are more affordable plans, we include this provision so that we would continue to have a strong deficit reduction bill as it moves to the Senate. And by the way, I do want to correct one thing. You said
Yes.
this amendment eliminates the essential benefits. It does not.
Well, it's shifted
It
to the
restores
states.
to the states
Well, well,
power to
yeah.
design them.
But it would
What
it
it
would,
eliminates is Washington knows best mandates that drive up healthcare costs.
well, that eliminates them as a guarantee. It leaves it up to which state you live in and what they're doing.
Power and returns it to the
Well, Washington's power to protect people's health and make sure they can get their prescription drugs.
Would the gentleman,
It's a good use of power. Mr. Walden?
could I respond as well? On June 17th of 2015, you, like others, became co-sponsor of H.R. 1624. It did almost precisely what we're doing here and was passed unanimously by the Congress. That took away the the federal mandate on the employer market between 51 and 100 on essential mandates, left it up to the states. So what you're concerned about today, I think you can get some relief on that you supported before when it passed the House, and actually you co-sponsored fundamentally what's in this amendment today for the employer market between 51 and 100.
Well, if that was the bill before us, we'd be having a different discussion. And
Well, 'cause it
probably
passed
President
unanimously and
Trump's desk.
nobody
There's
objected.
a lot more to this and how it fits together than simply this piece. So, you know.
But do you have a,
There are a number of bipartisan ideas which Democrats would be happy to work with Republicans on and get them to the president's desk and get them signed.
would the gentleman yield?
But in the context of this bill, there's not a lot in it to like. Now, if we want to have a process where we can find out, can we save money? Can we cover more people? Can we make healthcare more affordable? And can we make sure we're doing it right by having the scoring come back from the Congressional Budget Office? We're happy to look at a number of elements of this bill as potential aspects of how to do that. But in seeing this for the first time at 6:30 this morning, without a Congressional Budget Office score, obviously that's a non-starter. We just don't know what's happening. Now, clearly, again, in this new manager's amendment, focusing on that, because we talked about some of the other things, there is a new tax increase for 5 years at least on the Medicare tax. So there's a new tax increase in this new amendment over the original bill. I think I'm understanding that some of that goes to the state, this sort of state slush fund that some people have called it, or the money the states would use. Now, the states that I've heard from, including my state, have said the money they're going to get under this is still far less than the costs that are going to be foisted on them. So many of them see it as just yet another unfunded Washington requirement where they're effectively getting far less money than it will cost them. Now, you are also now allowing them to change or to deprive, if you will, Americans of prescription drug access, mental health parity, rehabilitative services, and many of them might in fact be forced to do that financially.
Would the gentleman yield?
Given to them might be insufficient to maintain those essential services. Happy to yield.
Yeah, we do not repeal the mental parity requirement.
Repeal what?
We do not repeal the mental parity
Well, I'm
requirement.
looking at the essential services, and one of the essential services is mental health and substance use disorder services. You're no longer saying that's an essential service. So to me, that is saying that insurance plans don't need to cover mental health.
It's actually a little different with the parity requirement. That's a separate
So
part
what
of
is
the
still
law.
required if it's, let's take it hypothetical, if the state said, we don't want to have coverage for mental health and substance use disorder services in our essential services, what does mental health parity accomplish outside of that if it's not covered?
It's still a requirement under the law, and the states would have the authority to determine the levels of the products that are offered, like your state would, like my state would, like my Democrat governor said they would continue
under
to
this
do.
amendment,
And the
they-
slush fund you referred to puts
amendment,
$15 billion into helping people with mental health, helping people with opioid addiction. We think that's more than a slush fund. We think that's an important investment in people's health and
Well,
lives.
again, the states I've heard from all heard that there's a hole. So, I mean, you're either telling the states they need to raise taxes or they need to remove some of the essential benefits. And that's exactly what they're going to have to do, but if this new law were to come out of Washington. So, again, while you increase taxes in this new manager's amendment, while you increase the size of the new federal entitlement program, you fail to actually cover more people, just as the first manager's amendment increased the deficit by $187 billion, didn't cover one additional person. So, again, are you correct that there's elements of this that we could talk together about and work together on? Of course there are, absolutely. And there's many ideas the Democrats have proposed that we hope would be considered in any effort. But to do that, I'm gonna move at least for an open rule. I'm hopeful that then Democrats and Republicans can bring forward good amendments that will expand coverage and reduce costs, and we can have a process, whether it takes a day or a week, we're not saying take months. I think Democrats are just saying, let's just take enough time on the floor where we can offer amendments and vote on them and have a better work product that, rather than be ashamed of, as so many members seem to be about this work product, that we can all be proud of, or at least 300 of us can be proud of, or 320 of us can be proud of, and the president can be proud of. I think that this misses that bar despite the last-minute tax increases in the manager's amendment, despite the increased deficits of the, I should say in part because of the increased deficits under the old manager's amendment, the lack of clarity about how the new manager's amendment even impacts the deficits. We can do better. I know we can do better. I hope that everybody looks in the mirror and asks themselves, can we do better? Not can I do better, because we all have our own perfect health care plan. I'm saying, can we do better? Can our collective work product be better? I think the resounding answer is yes, which is why I'm going to move for an open rule, why I oppose this bill in its current form, and I yield back.
Gentleman yields back his time. Thank you very much. The gentleman from Louisville, Texas, Dr. Burgess. Dr. Burgess does not seek time. The gentleman from Alabama.
Mr. Chairman,
Yes, sir.
read the bill, the amendment, understand the amendment, support the amendment, yield back.
Thank you very much. Gentleman from the state of Washington. Gentleman does not seek time. The gentleman from Windsor, Colorado.
Thank you, Mr. Chairman. Just briefly, I wanted to ask my friend and colleague from Colorado if he had a dimmer for that tie. Could you turn that down just a little bit? Between the shiny scalps between the two of us and the brightness of that tie, it is blinding those.
Gentleman yield, I just wanted to make sure that you were awake on that side of the aisle.
Awake but blind. Very briefly, Chairman Brady, first I very much appreciate the time we get to spend every week at a dinner, and I very much appreciate the example you set for the new members of Congress. My question is, the gentleman from Massachusetts has used words like backroom deals and misleading and slush fund, bribe, ashamed, horrifying. You've been here longer than I have. Do you ever get used to that?
Never, never. It is frustrating because these are such basic principles. So how should Americans get their health care? Should it be dictated and directed by Washington, or should it be tailored to their needs and offered through their states and communities? And I think the answer that most Americans believe is they deserve health care directed in their communities and states, tailored to their needs.
Is it possible to disagree about an issue in this place and actually not use inflammatory words and try to get the public all upset and actually not go to the motives of people and actually talk about policies?
You know, I think there is, and I hope we will return to that soon.
I wanted to read you a quote. It's from Barney Frank, and he said it in the Huffington Post, and I don't typically read the Huffington Post, but one of my staffers did give this to me. He said, but frankly, the president ought to never have mentioned, as he did, that if you like your existing overall health care strategy, you can hold it. That wasn't accurate, and you shouldn't lie to individuals. And they just lied to folks. Did you serve with Barney Frank by any chance?
Yes, sir.
Was he a Republican or a Democrat?
A Democrat.
Okay. I also wanted to quote, read you another quote here and get your thoughts on this. This is from Jonathan Gruber, and he was actually employed by the Democrats to work on, and it was called the architect of the Affordable Care Act. And he said, in terms of risk-rated subsidies, if you had a law which said that healthy people are going to pay in, you made explicit that healthy people pay in and sick people get money, it would not have passed, okay? Lack of transparency is a huge political advantage. And basically, call it the stupidity of the American voter or whatever, but basically, that was really, really critical for the thing to pass. And the thing was the Affordable Care Act. Just wondering what your thoughts are on that.
My belief, Congressman, is that Americans are smart. They know they're being forced onto plans they can't afford and can't use. Young people figured it out very quickly. They were being overcharged. And the rest of America now knows this is a sinking ship, Obamacare, and it will take so many of them down, and that Congress needs to act now. And at the end of the day, you correct me, but Americans want to be in control of their health care, not Washington. And that's what the amendment before us today does. It rips power out of Washington, D.C., and returns those choices and control back to the American people. That's the heart of this amendment.
Thank you. I yield back, Mr. Chairman.
Gentleman yields back his time. Thank you very much. Gentlemen, I want to thank you. I want to just, in my brief comments, I want to say, first of all, that I concur with both of you, and in particular with Chairman Brady. The Congressional Budget Office is a valuable asset to the United States Congress and the American people. And I will tell you that I have had nothing but fabulous work from and have confidence in, and that we gave them a tough task. Secondly, Chairman Walden, you and I have always had a saying about what we're trying to do. That is, we're trying to leave our campsite better than what we found it. As Eagle Scouts, we have that obligation on ourselves, and I hope and believe that that's what we're trying to do here today. I want to thank both of you for taking your morning, and you're now excused, and thank you very much.
Mr. Chairman,
Yes.
if I could, I do want to acknowledge the hard work on both sides of the dais the staff has put in. This has been an unusually lengthy process, both in the committee process, Ways and Means, Energy and Commerce, now in the Rules Committee. And our staff have been here with us every step of the way, so I applaud them. Thank you.
Thank you very much. And I believe that the accolades go to the members on both sides, not just the staff, because the performance of this has been important. Okay. Is there any other member that would, oh, we're closed. We're done. Okay. This now closes the hearing portion of the section that we were here today for, H.R. 1628. Chairman will be in receipt of a motion from the gentleman from Oklahoma.
Mr. Chairman, I move the committee grant H.R. 1628, the American Health Care Act of 2017, a closed rule. The rule provides 4 hours of debate, equally divided and controlled by the chair and ranking minority member of the committee on the budget or their respective designees. The rule waives all points of order against consideration of the bill. The rule provides that the amendment printed in Part A of the Rules Committee report, modified by the amendment printed in Part B of the report, shall be considered as adopted. The rule provides that the amendment printed in Part C of the Rules Committee report, modified by the amendments printed in Part D and Part E of the report, shall be considered as adopted. Finally, the rule provides that the bill as amended shall be considered as read. The rule waives all points of order against provisions of the bill as amended. The rule provides one motion to recommit with or without instructions.
Thank you very much. You've now heard the motion from the gentleman from the great state of Oklahoma. I'd like to defer to myself for a brief explanation. H.R. 1628, the American Health Care Act, is a closed rule, 4 hours of debate provided to the chair and ranking member of the committee on budget or their designees. It self-executes the manager's amendments as amendment and allows a motion to recommit to our friends, the Democrats. We would now ask for any amendment or discussion.
Mr. Chairman?
Gentleman from Massachusetts.
Yes. Well, first of all, Mr. Chairman, in response to Mr. Buck, let me just state for the record, and let me be very clear. I meant every word I said, and I stand by every word I said. The gentleman wanted to quote some Democrats. I've just been handed a stack of quotes from Republicans, one after another, from Senator Mike Lee to John Kasich to Governor Paul LePage to Justin Amash. I go right down the list, all expressing deep concern over the very flawed process that the Republicans have undertaken here. These are all Republicans. I would normally read them all, but I'm a nice guy, and so I'm not going to read them all to you today, so we can move forward. But, Mr. Chairman, I just want to say that I am disappointed by this rule, but I'm not surprised. As my friend from Florida said the other night, a bad process will lead to a bad product, and this rule is a bad product. First of all, it's closed. No amendments allowed, even though many members, even of your conference, wanted a chance to debate their ideas on the floor. And beyond that, frankly, it's a mess. Let's see if I can follow this. The amendment in Part A will be amended by the amendment in Part B. The amendment in Part C will be amended by the amendments in Part D and E. The bill was broken, and you slapped together some deals to try to fix it. Both the bill and the deals were so sloppy. They both also needed technical fixes, by the way. And now we've got one last backroom deal being written into the bill. What a mess, Mr. Chairman. There are fixes to the fixes to the fixes. And I don't know, but maybe you can get us a flow chart for the floor. But as I said at the beginning, the disappointment that we have in this process and in the final product cannot adequately be expressed in words. So with that, I yield back my time.
The gentleman yields back his time. Thank you very much. So we will move forward on the motion that is the gentleman from Colorado.
I move to grant the necessary waivers to grant an open rule to the HR 1628. If I may speak to that, Mr. Chairman?
The gentleman's recognized for discussion.
As I indicated, I think this body can do better collectively, and we can have a process that if this amendment passes, I will also make an amendment to, that would be considered friendly to increase the time for the debate of the bill, because I think we will need more than a few hours, and we'll just go and, for a week or two and offer a lot of great ideas, and hopefully we'll have a better work product, and I hope my colleagues support my amendment. I yield back.
Thank you very much. I hear a motion on the floor for an open rule. I also would open to a discussion. I'd like to, and I'm sure the gentleman said this, I may have heard it wrong, but we'll have a rule for 1 hour and 4 hours of debate.
Yeah, and what I said is if my first amendment passes, I'll actually do a subsequent amendment to increase the time of the debate.
Good.
But I'm not going to do that right now. I'm only going to do it after my first
I get that.
amendment
I'm just trying to make sure we offer clarification. I offer nothing but accolades for the gentleman to be able to offer that at a minimum. Is there a further amendment or discussion? I'm sorry, is there further discussion on the amendment?
Mr. Chairman,
Gentleman from Georgia.
as the Rules Committee is designated to the Budget Committee, I'd say that I hope there will be some healthcare bills that we can bring under an open process, but because of the reconciliation nature of this bill and the way that each provision has to be vetted by the Senate parliamentarian, this bill just can't be done in that kind of process on the floor, and I would oppose the gentleman's amendment.
Thank you very much. Gentleman from Massachusetts.
Yeah, no, I would just say that, we talk about process, we have 5 amendments here that are self-executed, that the majority is making in order, so I would support the gentleman's amendment.
Okay. Okay, let's move to a vote. The vote will now be on the Polis amendment. Those in favor signify by saying aye.
Aye.
Those opposed, no? No. Noes have it, noes have it. Gentlemen, that's a roll call vote. The clerk will poll the committee.
Mr. Cole? No. Mr. Cole? No. Mr. Woodall? No. Mr. Woodall? No. Mr. Burgess? Mr. Burgess? No. Mr. Collins? No. Mr. Collins? No. Mr. Byrne? No. Mr. Byrne? No. Mr. Newhouse? No. Mr. Newhouse? No. Mr. Buck? No. Mr. Buck? No. Ms. Cheney? No. Ms. Cheney? No. Ms. Slaughter? Mr. McGovern?
Aye.
Mr. McGovern? Aye. Mr. Hastings?
Yes.
Mr. Hastings? Aye. Mr. Polis? Aye. Mr. Polis? Aye. Mr. Chairman?
No.
Mr. Chairman? No.
The clerk will report the total.
3 yeas, 9 nays.
The amendment's not agreed to. Further amendment or discussion. Gentleman from Colorado.
Well, I since that motion failed, I'm not going to increase the debate time. I think, it's there's a lot to debate, and it may very well take longer, but I think that I won't make that amendment at this time, since there's really no amendments to discuss besides the ones that are self-executing and the manager's amendment, mostly just the bill itself, and I'll yield back.
Thank you very much. The vote will now be on the motion from the gentleman from Oklahoma. Those in favor signify by saying aye. Aye. Those opposed, no.
No.
The ayes have it. The
Mr.
ayes have it.
Chairman, I ask for a roll
The
call
gentleman
on
asks
that.
for a roll call vote. Clerk will poll the committee.
Mr. Cole? Aye. Mr. Cole? Aye. Mr. Woodall? Aye. Mr. Woodall? Aye. Mr. Burgess? Aye. Mr. Burgess? Aye. Mr. Collins? Aye. Mr. Collins? Aye. Mr. Byrne? Aye. Mr. Byrne? Aye. Mr. Newhouse? Mr. Newhouse? Aye. Mr. Buck? Aye. Mr. Buck? Aye. Ms. Cheney? Ms. Cheney? Aye. Ms. Slaughter? Mr. McGovern?
No.
Mr. McGovern? No. Mr. Hastings?
Nay.
Mr. Hastings? No. Mr. Polis? No. Mr. Polis? No. Mr. Chairman?
Aye.
Mr. Chairman? Aye.
Clerk will report the total.
9 yeas, 3 nays.
The motion is agreed to, and accordingly, I will be handling this for the majority,
I will handle it for
and the gentleman
minority.
will be handling this. Mr. McGovern will be handling this for Democrats. Okay, we've completed our work. Let me go back over and say it again. Thank you to the members and the staff for a lot of hard work. Quickly. I would say that I would anticipate that we will get that done quickly. Thank you very much. This finishes the Rules Committee work for the week.